an outsourcing discussion rather than not an outsourcing is a bad, but it's a B2B service rather than a scientific discussion you would have with ECOE or this kind of service.
Yes, correct. Exactly. They do have obviously some very renowned cardiac safety specialists on staff, but when Dr. Jeff Litwin left, it didn't seem to really affect the customer's perception of ERT as a leader in the cardiac safety space. So I think the scientific knowledge that they have, while it informs what they do, I don't think it's as important to pharmaceutical companies or CROs as respiratory or ECOA.
So it's a price discussion then?
Right, exactly. Yes, correct.
And in terms of who is on the market, so there was ERT, iCardiac, they now merged together. Would you have a view on who is on the market in Europe, US, in terms of being able to provide, all these phase 3 where you need thousands of reads?
Yeah, so like you said, there are CROs who have the ability to do that in-house. The iCardiac the iCardiac acquisition was interesting because, the urban legend is that iCardiac was founded by people who left ERT. Funny enough.
Which is probably the same in ECOA, right? ERT has kept on buying people that left and then founded new companies, right?
Yep, that's exactly right. So a lot of people who used to work for ERT came back to work for ERT once they acquired iCardiac. But, there's MedPace, which is, on the competitive horizon, Solarion, somebody called Vince and Associates. I can't think of anybody else who's like a really big. Spalding, I think Spaulding. Spalding, I think is. I'm trying to think of places. Yeah, but they may act as a CRO. Spalding.
And do you have a view on the market share of the biggest players? Like who would be the dominant, probably ERT?
I think before ERT acquired iCardiac, they do have ERT has an internal group that does strictly total available market evaluations. So they've got, there's a woman named Ness Mast and she's got a little group and all they do is look at market share. They look at clinicaltrials.gov and look and see how many trials are running, how many patients they're expecting, sort of price it out and say. So before they acquired
clinicaltrials.gov by heart from the first to the last trial every day.
Yeah. Everybody lives by it, right? They use that and something called ZymeWire. Are you familiar with ZymeWire? ZYME, ZymeWire. It's a pretty nice service, actually, ZymeWire. So they'll use those two things and put together total available market estimations. And before they acquired iCardiac, ERT felt that they were 50 to 60% of the market. And after the acquisition of iCardiac, they feel like they are 70% of the market.
Europe, US, like all the EMA, FDA market.
Correct. Yep.
That's big.
Yeah. Well,
is there any growth in there apart from the 1% growth of the number of phase 2-3 trials you have in the world?
So that the phase 1 and phase 2 are markets that ERT is aggressively going after because they recognize that's a method to get additional business, and they feel like if they can get in phase 1 or phase 2, then they become the incumbent provider, and there's sort of a no selection in phase 3 because they already have worked themselves in.
Because usually your phase 1, phase 2, you would still use an on-site reading and you wouldn't bother.
Correct.
So there is still some outsourcing potential, not outsourcing, but some digitalization, centralization process which are driving the market, which is the early phases.
Correct. That's correct. Yep.
Yeah.
Yep. And phase 4 is, almost a non-existent market for, yeah.
And so what does it drive the market growth to?
Once they